Okay, real talk, how many of you have ever picked up something at your local health food store, or maybe even the vitamin aisle at Walmart, and thought, well, it's natural, so it can't hurt me, right? I mean, I've had patients tell me they were taking something to help them sleep, something for their anxiety, something for their energy, all herbal, all natural. And then look at me completely surprised when I told them it could be interacting with their blood pressure medication, or their antidepressant, or affecting their liver. And I get it. I really do. When something grows from the earth, it feels wholesome. It feels safe. But here's what 20+ years of nursing has taught me. Just because it comes from the earth does not mean it's free from risk. Hey, I'm Rhonda. I'm a registered nurse and health educator, and this channel is where we get real about health topics that your doctor might not have had time to cover in a 15-minute appointment. No fear, no judgment, just honest, evidence-based information so you can make the best decisions for your body. Today, we are talking about 8 herbs that most people assume are totally harmless, and some of them might genuinely surprise you. We're going to cover kratom, kava, khat, betel nut, blue lotus, valerian root, St. John's wort, and ginseng. Some of these you may already have in your cabinet right now. If you're new here, make sure you hit that subscribe button. We drop new health education videos every week, and you do not want to miss what's coming. Now, let's get into it. Number 1, kratom. So let's start with kratom. If you've been anywhere near a gas station, a vape shop, or honestly just the internet in the last few years, you have probably seen this one. It comes from the leaves of a tree native to Southeast Asia, and people take it for all kinds of reasons. Chronic pain relief, to help with opioid withdrawal, anxiety, energy, you name it. It's often sold as a powder, a capsule, or brewed into a tea. And because it comes from a plant, and you can buy it pretty much anywhere, a lot of people assume it's perfectly fine. But here's what you need to know. Kratom's active compounds act on opioid receptors in the brain. This means the risks mirror opioid risks, sedation, nausea, physical dependence, and in high doses, respiratory depression. The FDA has explicitly warned consumers against using kratom, citing risks of liver toxicity, seizures, and substance use disorder. It can also interact dangerously with CNS depressants, benzodiazepines, alcohol, and SSRIs. Here's what I would tell a patient. Kratom is not an herbal supplement in the traditional sense pharmacologically. It behaves like an opioid. If you are taking kratom for pain or to manage withdrawal, please talk to your provider. There are evidence-based options that are monitored and far safer. Number 2, kava. Kava is a plant native to the Pacific Islands, and traditionally it's been brewed into a ceremonial drink. In the US, you're seeing kava bars pop up everywhere, marketed as a way to feel calm and social without alcohol or a hangover. People buy it thinking it's a gentle, natural anti-anxiety remedy. But kava carries a well-documented risk of serious liver damage. Cases of liver failure, including fatalities, have been reported. The FDA has determined that commercially available kava beverages are not safe for human consumption as recreational drinks. Kava also inhibits CYP450 enzymes, potentially increasing plasma levels of many medications, including benzodiazepines, antidepressants, and anticoagulants. And recent data shows that 30% of all kava-related poison center reports now involve co-use with kratom, a combination associated with dramatically higher rates of serious outcomes. The liver doesn't know something is natural. It processes kava the same way it processes a medication, and for some people, that processing goes badly wrong. If you have any liver condition, drink alcohol regularly, or are on medication that affects the liver, kava is a real concern. Number 3, khat. This one may be new to some of you. Khat is a plant from East Africa and the Arabian Peninsula, and chewing fresh khat leaves is a deeply rooted social tradition in places like Ethiopia, Somalia, and Yemen. It's used as a stimulant to boost alertness, reduce fatigue, and promote social interaction. People who grew up with it may genuinely see it as no different from drinking coffee. But khat contains cathinone and caffeine compounds with stimulant effects similar to amphetamine. Cathinone is a Schedule I controlled substance in the US. Khat use is associated with elevated heart rate, hypertension, myocardial infarction, and arrhythmias. Chronic use is also linked to psychosis, mania, insomnia, and depression. I want to be culturally sensitive here, while also being clinically honest. The cardiovascular risk is real. If you have high blood pressure, heart disease, or you're on medication for either of those things, this is a conversation you need to have with your provider. The cultural context doesn't change the pharmacology. Number 4, betel nut. Here's a staggering statistic. Approximately 600 million people worldwide regularly chew betel nut. It is one of the most widely used psychoactive substances on the planet, after caffeine, nicotine, and alcohol. It's deeply embedded in the social and cultural fabric of South Asia, Southeast Asia, and the Pacific. Surely something used by that many people for centuries must be safe, right? Actually, betel nut is classified as a Group 1 carcinogen by the International Agency for Research on Cancer. Long-term use is strongly linked to oral submucous fibrosis, a precancerous condition, and oral squamous cell carcinoma. It's also associated with hypertension, ischemic heart disease, and increased cardiovascular risk. Research has identified over 80 potential drug interactions, as betel nut constituents affect numerous drug metabolizing enzymes. If you have a patient who uses betel nut, this is not a benign habit. The oral cancer risk alone should be part of the clinical conversation. And with over 80 potential drug interactions, if your patient is on multiple medications and using betel nut, you may be chasing lab values without knowing the real culprit. Number 5, blue lotus. This one has been absolutely blowing up on social media. Blue lotus is an ancient Egyptian water lily being sold online and in wellness shops as a tea, a tincture, a vape, or even a wine infusion. The marketing leans heavily into the mystical angle used by the ancient Egyptians for spiritual rituals, relaxation, and even lucid dreaming. People assume that if the ancient Egyptians used it in ceremonies, it must be safe. I love history, but I need us to think clinically for a moment. Blue lotus contains nuciferin and apomorphine compounds that affect dopamine and serotonin receptors and exert sedative effects. The most critical risk is combining blue lotus with other CNS depressants, alcohol, benzodiazepines, opioids, or sedatives, which can cause life-threatening respiratory depression. It also creates dangerous interactions with antidepressants, antipsychotics, and psychiatric medications. Emergency room reports have documented tachycardia and chest pain following blue lotus use. And it's not FDA regulated, meaning potency and purity are completely inconsistent. The ancient Egyptians did not have benzodiazepines, SSRIs, or blood pressure medications. The context has changed completely. If anyone in your life is vaping blue lotus and taking a psychiatric medication, that is a conversation that needs to happen today. Number 6, valerian root. Now we're getting into territory that feels more familiar. Valerian root has been used for centuries as a sleep aid and anxiety remedy, and you can find it in almost any pharmacy or grocery store in America. It's been in grandmother's medicine cabinets for generations. What's the harm? Well, let me share what we actually know. Valerian enhances GABA activity in the brain, the same mechanism as benzodiazepines like Xanax or Valium. Combining them creates additive sedation, increasing fall risk and next-day cognitive impairment. It can also potentiate alcohol, opioids, and antihistamines. Abrupt discontinuation after prolonged use can cause rebound insomnia and withdrawal-like symptoms, including heart palpitations. And critically, valerian must be discontinued at least 2 weeks prior to surgery because it can potentiate anesthesia. If you are taking a sleep medication and you're also taking valerian root, you could be stacking sedation on top of sedation. For an elderly patient, that could mean a fall in the night. And if you have surgery scheduled, your surgeon needs to know you're taking valerian. Number 7, St. John's wort. St. John's wort might be the most widely researched herbal remedy for depression on the planet. Studies have shown it has real antidepressant effects for mild to moderate depression. And because it's natural and costs around $10, millions of people take it instead of or alongside prescription antidepressants. But this is one where the interaction risk is genuinely serious, and I need you to hear me on this one. Combining St. John's wort with SSRIs, SNRIs, or MAOIs can cause serotonin syndrome, a potentially life-threatening condition characterized by agitation, rapid heart rate, high fever, and muscle rigidity. St. John's wort also significantly speeds up the metabolism of dozens of critical medications through CYP3A4 enzyme induction, including HIV antiretroviral medications, immunosuppressants like cyclosporin for transplant patients, oral contraceptives, warfarin, digoxin, and cancer chemotherapy agents. We have documented cases of transplant organ rejection, HIV breakthrough, and unintended pregnancies linked to this one herb. If you are on an antidepressant, any antidepressant, and you are also taking St. John's wort, please call your provider today. Not next week. Today. Number 8, ginseng. We're rounding out our list with one of the most beloved herbs in global wellness culture, ginseng. It's in energy drinks, teas, capsules, and foods. It's synonymous with vitality and longevity. People take it to boost energy, sharpen mental focus, support the immune system, manage blood sugar, and improve athletic performance. So what's the concern? Ginseng can reduce the effectiveness of warfarin, potentially leading to clot formation in patients who rely on anticoagulation therapy. It inhibits P-glycoprotein, which can significantly increase digoxin serum levels, AU, a dangerous scenario given digoxin's narrow therapeutic index. Ginseng also has documented hypoglycemic effects, OGO. In patients taking insulin or oral hypoglycemics, this can cause dangerously low blood sugar. It has mild estrogenic activity, making it generally contraindicated in hormone-sensitive conditions. And it must be discontinued at least 7 days before surgery due to effects on platelet aggregation. This is the herb I have the most conversations about in practice because it's so widely used that people genuinely don't mention it when I ask about supplements. They think, oh, that's just ginseng, oh. It's in my tea. It doesn't count. But if you are on digoxin, or warfarin, or metformin OO, it absolutely counts. Please list every supplement, every tea, every energy drink on your medication list. All right, we made it through all 8 kratom, kava, kot, betel nut, blue lotus, valerian root, St. John's wort, and ginseng. And I want to leave you with this. None of this is meant to scare you away from natural remedies. Some of these herbs have real, documented benefits in the right context, with the right monitoring. What I want you to walk away with today is a healthier skepticism, not cynicism, but informed awareness that natural and safe are not the same word. You now know what most people don't. And that's exactly why you're here. Drop a comment below and tell me which herb surprised you the most today. I read every single comment. If this video was helpful, please hit that like button. It really does help this channel reach more people who need this information. And if you're not subscribed yet, hit subscribe so you don't miss our next video. And finally, if your doctor or pharmacist has never talked to you about herb-drug interactions, bring it up at your very next visit. You deserve a provider who takes your full picture seriously, and that full picture includes everything you're putting in your body. I'm Rhonda. Stay curious, stay informed, and take care of yourselves. I'll see you in the next one.